Let's introduce our group. 5, 4, 3, 2, 1. Fadhly, Rizky, Rahman. Yukomeyta, Zohra, Yusuf. Delvry, Natasya, Velo. Alia Kuku. Wike, Saskia, Yusuf. Anggi, Pratiwi, Suleman. And this is our group video. Enjoy watching.
Mr. A, 65 years old male, was admitted to medical ward with complaints of shortness of breathing, productive cough, fever, and chest discomfort through the past 4 days. He reported his cough products yellow, freeze green, sputtering, and that his breathing had gone more difficult, especially during physical activity. He also felt weak and experienced decreased appetite. Mr. A has a history of smoking for 30 years and was diagnosed with hypertension 5 years. He lives with his wife and is retained. On admission, his vital signs were temperature, DD, pain, I, Celsius, blood pressure, 150, D were 90, high G, pulse rate 102 beats per minute, respiratory rate 28 breaths per minute, and oxygen saturation 90% on room A. Physical examination revealed the use of accessory muscles during creating crickles and auscultation. The low and dullness on precision. The patient appeared and chest and slight cyanotic lobes. A chest X-ray saw consolidation in the right lobe. Laboratory result indicated elevated blood cell count.
Pneumonia is a major health problem that continues to have high morbidity and mortality rates, both globally and in Indonesia. Pneumonia is an acute infection or inflammation of the lung in China, characterized by pulmonary infiltrates and clinical symptoms such as coughing and shortness of breath. This disease can be caused by various infectious agents such as bacteria, viruses, fungi, and aspiration of foreign substances.
A patient began experiencing coughing, shortness of breath, and chest pain 3 days ago. His condition has worsened today, and he appears weak. The family, noticing these changes, is worried and decided to immediately take the patient to the hospital.
See, why are you going so much?
I feel so big and my chest hurts.
See, Since when?
Since today, but today is worse.
You're waiting so happy. I think we shall go to hospital.
Yes, I feel very weak.
Without delay, the family immediately prepared and helped the patient. Go to the hospital, filled with worry, they hoped the patient's condition could be addressed by medical personnel soon. The journey to the DOT hospital began with the hope of improvement in the patient's condition. On the way to the hospital, the patient's condition was still unstable. He appeared to have difficulty breathing, while his family tried to calm him down and help him regulate his breathing to remain slow and controlled.
Please stay calm. Breathe slowly.
It's hard. I can breathe well.
Upon arriving at the hospital, the patient was immediately taken to the DOT emergency room to receive assistance.
Good afternoon, ma'am. Sir, I'm the nurse. What's your complaints?
He has soreness of breathness.
Oh my gosh. Come on, sir. Come on, sir. Okay, sir. I will check your condition. Just a moment, sir.
The nurse called the on-call doctor to check the patient's condition. While waiting, the family doctor calmed the patient down.
Excuse me, sir. Your breathing sounds are abnormal. We will give you oxygen therapy. Please stay calm and try to breathe slowly. Please monitor the patient's vital signs and oxygen saturation regularly.
Yes, doctor.
The examination results show respiratory distress. The respiratory rate is increased and oxygen saturation is decreased. The medical team immediately administered oxygen therapy and regularly monitored vital signs to stabilize the patient's condition.
Excuse me, sir. I will check in your breathing. Please relax. Excuse me. Respiratory rate is 30 breaths per minute. Oxygen saturation is 88. This is low. We will give oxygen therapy now.
Excuse me.
How are you, sir, after the oxygen was installed? Are you feeling comfortable?
Yes, of course.
Okay, sir, we'll be back soon.
With the initial treatment given, the patient's condition continues to be observed to see further developments. The patient remains under intensive monitoring. The therapy given is expected to gradually help improve respiratory condition. After the condition started to improve, the nurse continued by providing health education to the patient and family. Nurse teaches proper breathing techniques and advises the patient to get enough rest, take medication regularly, and maintain a healthy lifestyle. The family is also given an explanation on how to prevent recurrent.
Sir, we will teach you breathing exercise.
Alright.
Inhale through the nose, hold for a few seconds, then exhale slowly.
Use short rest, drink enough breaths, and take your medication regularly. How can we prevent this from happening again? Avoid cold air, stop smoking, and maintain a healthy lifestyle.
How do you feel now?
I feel very better, but still feel weak.
We will continue monitoring your condition.
Yes, ma'am.
Here, the doctor will be here again in a moment to provide education.
That's so sad.
During the evaluation stage, the patient begins to show improvement with easier breathing. Although still feeling weak, the medical team will continue to monitor the patient until the condition is fully stable.
Good afternoon, sir. How are you feeling after the treatment?
I feel better. My breathing is not as tight as before.
That's good to hear. Your oxygen level have improved and the medication is working well.
We have provided oxygen therapy and breathing exercises. Now we need to prevent your condition from getting worse again.
One important step is to stop smoking. Smoking is one of the main factors that worsens lung infection like pneumonia.
Now that I feel better, is it still dangerous if I continue smoking?
Yes, it is still dangerous. Even if you feel better, your lungs are still improving. Smoking can trigger another infection and worsen your breathing again.
Smoking also increases mucus production and causes airway inflammation, which can lead to shortness of breath again.
We will help him stop smoking and keep the home environment smoke-free. That excellent family support plays a big role in recovery and preventing relapse.
You can start by reducing the number of cigarettes, avoiding triggers, and replacing the habit for activity like deep breathing exercises.
I understand, sister. I want to try stop smoking.
Very good. We will continue to monitor your condition and support you in disease process. Thank you, nurse.
Overall, patients experiencing respiratory problems require prompt and appropriate management from the early onset of symptoms. Through DOT assessment, monitoring, oxygen therapy, and proper education, the patient's condition can gradually improve. The role of both the family and medical team is essential in the recovery process. So it is expected that the patient can return to good health and prevent recurrence in the future. Based on the data obtained, there are several main nursing diagnoses, namely impaired gas exchange due to changes in the alveolar dot membrane, indicated by shortness of breath and decreased oxygen dot levels. In addition, there is ineffective airway clearance due to as well as hyperthermia caused by the infection dot process. The patient is also at risk for nutritional deficiency. The expected outcomes, or SLKI, focus on improving gas exchange, maintaining airway clearance, stabilizing body temperature, and improving the patient's nutritional status. Meanwhile, the interventions include respiratory monitoring, airway management, effective cough therapy, medication, administration, temperature management, smoking cessation support, as well as nutrition and energy management to accelerate the patient's recovery.
Support the patient recovery. Supportive nursing intervention are implemented based on the identified problem. This intervention aims to improve respiratory function, stabilize the patient condition, and promote overall recovery. The interventions include 1. Respiratory monitoring. Respiratory monitoring is carried out to assess the patient breathing condition, including respiratory rate, breathing pattern, and oxygen saturation. This is important for early detection of respiratory problem. 2. Smoking cessation support. Smoking cessation support is profit to reduction in creation in the respiratory tract, promote healing, and prevent further duration of lung function. 3. Anxiety reduction. Anxiety reduction is done by providing emotional support to help the patient feel calmer, as anxiety can worth shortness of breath. 4. Airway management. Airway management allows to keep the airway open and clear, allowing air to flow in and out smoothly. 5. Effective cough training. Effective cough training is to help the patient expel secretion from the airway, improving breathing comfort. 6. Hypothermia management. Hypothermia management is carried out to reduce elevated body temperature caused by infection, helping stabilize the patient conditions. 7. Medication administration. Medication are administered according to identification to to treat infection, relieve symptoms, and occur the healing process. 8. Nutrient management. Nutrient management aims to meet the patient energy and nutrient needs to support optimal rectification. 9. Energy management. Enregionen en rent in the flesh left warning activity and rest the preform vertical that call warns the patient condition. Overall, this case highlights the importance of early recognition and proper management of respiratory problems. The patient initially experiences symptoms such as coughing, shortness of breath, and chest discomfort, with gradually worsened over time. This condition recurs immediately. Attention to prevent further complication and ensure patient safety. Through a systematic nursing process starting from assessment, diagnosis, planning, implementation, and evaluation, the patient provided comprehensive care. The identified nursing diagnoses, including improper gas exchange, ineffective airway clearance, hypothermia, and release of nitrogen now deficiency, guided the healthcare team in determining appropriate intervention. The implementation of nursing intervention, or SEIKI, played a crucial role in improving the patient condition. Respiratory monitoring allowed early detection of any deterioration, while airway management and effective cough training helped maintain airway patience and remove secretion. Oxygen therapy and medication administration support the stabilization of the patient respiratory status and treated the underlying condition. In addition, holistic care ways profit track anxiety reduction, ensuring the patient remain calm and cooperative during treatment. Nutrition and energy management were also essential in supporting the patient recovery process by maintaining adequate strike and prevent fatigue. Smoking can support for head contribute to long-time respiratory health and prevent of recurrence. Health education given to both the patient and family is equally important. By understanding proper breathing technique, medication adherence, and lifestyle modification, the patient is better prepared to manage their condition and prevent future episodes. Family informant also plays a significant role in providing emotional support and ensuring continuity of care at home. At the effervescent state, the patient has signs of impairment, particularly in breathing comfort. Although some weakness remain, continuous monitoring and follow-up care are necessary to ensure for recovery and to detect any potential complication early. In conclusion, effective nursing care requires it not only clinical skills, but also a holistic and patient-centered approaches. Collaboration between healthcare providers, patient, and family is essential to achieve optimal outcomes. With timely intervention, proper management, and consistent education, patient with respiratory problem can be recovered well, and maintaining a better quality of life while reducing the rise of frank corns in the future. This includes the nursing care process from assessment to evaluation, discusses how the respiratory problem required prompt, accurate, and comprehensive management to prevent further complication. Trick operate interpretation, family support, and continued health education. The patient condition can improve and the risk of recurrence can be reduced. Therefore, collaboration between healthcare providers, patients, and families is essential to achieve optimal recovery and maintain a better quality of life in the future. Thank you.
One is the loneliest number that you'll